The government tells the public that the country's COVID treatment and isolation facilities still have room for more patients. While the DOH still recommends home quarantine for mild or asymptomatic patients, Health Undersecretary Maria Rosario Vergeres says if patients can't comply with the government's health protocols, then they're better off at temporary treatment and monitoring facilities. Let's get the latest on this from Marian Enriquez. She's reporting to us live from Mandaluyong. Good afternoon.
Good afternoon. Charles, the Health Department assures the public that there are enough beds and quarantine facilities for asymptomatic patients or COVID-19 patients, as well as those with mild symptoms. The Interagency Task Force discouraged home quarantine for patients with mild symptoms, citing the risk of further spreading the virus and infecting other members of the household. The Health Department touts the government's more than 8,200 Ligtas COVID centers all over the country. These are community-managed facilities dedicated to isolate suspected cases. Of the total 70,000 beds, the DOH says only 25% are occupied. On top of these, the national government manages at least a dozen mega-quarantine facilities that could accommodate more than 3,000 patients. These are often large, spacious buildings converted to house patients such as the PICC, the Rizal Memorial Coliseum, the World Trade Center, the Ninoy Aquino Stadium, and Philippine Arena. And with occupancy rate only at 38%, Health Undersecretary Maria Rosario Vergeres says these sites can still admit patients. As of July 11, the DOH tallied over 12,600 suspect and probable cases who are under home quarantine.
Although in some of the LGUs, it was reported to us na nag-transfer na rin sila ng iba nilang mga pasyente dito at dinala na sa ating mga temporary treatment and monitoring facilities.
The thing with home quarantine is they're only effective if patients and family members strictly abide by the health department's protocols, such as having a separate room and toilet, as well as household items like cups, utensils, towels, and even beddings for positive or suspect cases. Healthcare workers also need to regularly check in on these patients, preferably daily home visits. If conditions are not followed, Vergeres said that it's better for patients to stay in government health facilities.
Ngayon, kung hindi rin naman mako-comply with yan, hindi na dapat tayo mag-home quarantine, doon na lang tayo sa temporary treatment and monitoring facility.
Charles, the Health Department also explained the country's highest overnight death toll. Vergeres blamed the surge on late reporting. After reconciling data from different regions, Vergeres says that of the 162 fatalities recorded on July 12, 51 patients actually died in July, while the rest expired in May and June. Charles.
All right, thanks for that. That was Marian Enriquez reporting live from Mandaluyong.